Hey everyone, my name is Dr. Josh Stewart here at Stewart Sport and Spine Physical Therapy in Ankeny, Iowa. So today I want to talk to you guys about a very unique presentation of our specialty niche here called sacroiliac joint dysfunction. So my patient here, Nathan, originally had back pain about 5 years ago. And when he injured his back, he went to an osteopath, had x-rays, MRIs done, and then he was diagnosed with a herniated disc on the right side of his lower back. So he was having pain going down into his leg, okay? What really stood out about Nathan's presentation initially is, yeah, he had kind of the typical SI joint presentation of having some achiness and like a dull ache in his right buttock. But when he bent forward, he felt this enormous pull in this right hamstring way before he even started feeling a pull in that left hamstring when he bent down. So he's just really, really tight on that right side compared to the left side. So as you know, with respect to SI joint dysfunction, it can present as a lot of other, lower back pain conditions. So it can have, radiating pain going down the back of your leg. So you think sciatica or like a pinched nerve. You can have anterior kind of hip pain into the thigh and the groin. So you're thinking more of a hip, joint pathology. So there's a lot of variable presentation. To make things even more confusing with respect to diagnosing SI joint dysfunction, it does not show up on X-ray or MRI. So you really got to be looking for it in order to diagnose it correctly. Okay, so with respect to herniated disc, usually about 6 months after you initially herniate that disc, about 90% of people have complete symptom resolution, so their pain is completely gone. So I was a little bit skeptical right off the bat to think that a disc that Nathan herniated about 5 years ago was the cause of his pain currently, and it might have been his initial cause of pain, but currently I was a little suspicious that there might be something else going on. Okay, so go ahead, Nathan, and stand up for me. So to diagnose this, we kind of went through an examination. So go ahead and turn and face that way. So go about feet shoulder width apart, and then just try to bend forward and just kind of tell me what you're feeling as you do that. Good.
Yeah, it's a little bit tight on this right side. I'm feeling a stretch in this hamstring before I feel it over here.
Okay, so we're going to go right into correcting that now. So go ahead and lie on your stomach for me, and I'll take your glasses over here. Perfect. All right. All right, so we're gonna do a quick pull on this right leg, and I'll explain what we're doing here in a second. But just go ahead and relax for me. You can hold on to the table. Good. Good. All right. So go ahead and stand up for me. All right, and then go ahead and go feet about shoulder width apart, and just kind of bend forward and tell me exactly what you're feeling when you do that. Good.
Oh yeah, I feel the stretch at the same time.
Good.
Now.
Good, good. All right, you can go ahead and take a seat, Nathan. So basically what we found, an SI joint dysfunction is one of two things, or it can be both of them at the same time. So what Nathan's big issue was specifically he had what we call an upslip. So this right hip bone actually went up a little bit there, and where this SI joint is, where this hip and the lower part of the spine meets, that created a compression and shearing force there, which kind of led his symptoms down his leg. And if you think about it, like if this hip joint goes up like that, the hamstring's attached right here. So if this goes up a little bit, naturally that's going to create more of a pull right there. So Nathan's about 4 weeks into his rehab, and for everyone that comes in here, it's about a 5 to 7 week process. Men usually take a little bit longer to fully stabilize this SI joint through a series of 5 exercises compared to females, just because we aren't quite as flexible as they are. But like I said, it's about a 5 to 7 week process, so Nathan here has about 3 to 4 more weeks to really get there and have everything stabilized here so that we don't have to do those corrections anymore, okay? So if this sounds like you and you've had presentation, similar to this, and you've been dealing with back pain and then pain going down into your leg for many years, and you really haven't found that long-term pain relief solution, go ahead and reach out to us today to schedule your consultation.